now my pleasure to introduce Claire Balassa, Sales Coordinator for Redeemer Health Life Care Communities. Claire understands the many decisions that factor into making the move to a new community. She loves working with prospective residents and their families to help them select the choice within Redeemer Health Communities that ideally meets their budget and lifestyle desires. Her attentiveness and patience enable many people to enjoy a seamless move and begin immediately to take advantage of the many services and amenities that await them at Redeemer Health Communities. Claire, it is my pleasure to hand the mic over to you.
Thank you, Bruce. Thank you for the introduction. We're delighted you could join us this evening. Tonight, you'll learn valuable information about a little-known benefit called the Veterans Aid and Attendance Benefit. But to start, I'd like to tell you a little bit about our Redeemer Health communities and our accommodations in our personal care communities, both at Redeemer Lafayette and St. Joseph's Manor. We have two communities, Lafayette in the Fox Chase section of the Northeast, and we have St. Joseph's Manor on the grounds of Holy Redeemer Hospital. Between the two communities, we have a wide range of floor plans, both rooms and apartment style living. Many amenities are included, including all 3 meals per day, housekeeping, nightly check-ins by the nursing staff, medication management, the list goes on and on. Residents and their families can enjoy peace of mind knowing that their loved ones are a part of a Redeemer Health personal care community. Most importantly, residents are treated like family. We recently did a video of St. Joseph's Manor showcasing the community, and I'd love for you to take a look at it.
And it doesn't matter what your role is here. The main reason that people are truly here is for the residents. It's a community and we're a family.
I oversee the daily operations of the personal care unit. I have a recreation background, so I still like to have fun with the residents. But yeah, we have a lot of fun.
In the personal care, we're doing exercise, art and crafts. We programming each month what activity we have to do for our residents. We going in the greenhouse and we planting their vegetables, eggplant, tomatoes, peppers, and they loved it.
I came to work at Holy Redeemer in '62, and I left in '97. And then when my own mother had an issue with living by herself, we were able to get her in here. So it really wasn't a question of, well, where do you want to go? I wouldn't want to go anywhere but here.
I have greeted many family members that have come through that door. They want to come back and bring their mother and father to me because I let them know, I'm here for your mom and dad.
The facilities are beautiful. We loved the dining room, we loved the rooms, we loved the common areas were really, really nice, and it just felt like a comfortable place.
Oh, the chapel, even when you don't go to pray, it was a great place to just sit and listen to the holy water font and just relax.
We serve people of all faiths, and we connect from a place of heart and soul.
Everyone is welcome, and I feel very blessed that I have this special time with them.
Sometimes it's the smallest things that the staff doesn't even realize made the difference in that resident's life.
It gives me a huge peace of mind knowing that he's happy and this is his home.
We would be delighted to have you visit one of our communities for a personal tour. And at the end of this presentation, you'll have the opportunity to request a tour at both Lafayette Redeemer and St. Joseph's Manor. Now it is my pleasure to introduce our featured presenter, Emily Schwartz. For over 20 years, Emily has helped elderly veterans and their spouses find ways to afford the care they need through the VA benefit. Additionally, she has harnessed her wealth of experience to launch aidandattendance.com, a website that helps veterans and families determine their eligibility and the amount of monthly award they can expect. The website also provides access to software that allows the lengthy VA paperwork process to be completed in only about an hour. Without further ado, I'll hand the mic to Emily.
Thank you so much, Claire. I'm assuming everyone can hear me, and I'm excited to share this information with you today. I know tomorrow is Veterans Day, and so no better week should we be sharing about this very valuable benefit with you. All right. Oh, sorry. Let's go back. There we go. Sorry, got to get used to that. All right, so let's talk about the monthly maximum VA benefit amounts. And I know this slide says 2023, and you're probably wondering, well, Emily, it's only November 10th. Why are you talking about 2023 already? Well, that's because the VA benefit actually goes up on December 1. The VA's fiscal year is December 1 through November 30th. So if you are considering applying for this benefit this month, next month, anytime in 2023, these are the fabulous numbers that you're going to see. The benefit is going up with the cost of living adjustment, 8.7%. So if you'd ever seen the benefits for 2022, this is a quite significant jump. So surviving spouses in 2023 can receive $1,432 a month. A single veteran can receive $2,229 a month, and a married veteran can receive one of two benefit amounts. Usually they get the higher dollar amount at the bottom of the chart, not just because it is such a large number at $2,642, but because this is the scenario that usually happens for the married veteran. So the higher dollar amount is when the veteran needs care himself or herself, and they're married. Now that spouse can either need care or not. Either way, that veteran will receive over $400 more than the single veteran because the veteran has a dependent. There's a married veteran amount where the veteran is healthy, but the spouse needs care, and that is the $1,750 a month. In this situation, the veteran will apply based on the spouse's care needs and care costs and get that $1,750 to help pay for their care needs. Now, you've been looking at the screen for a while, and you see that these dollars are paid tax-free and directly to the applicant. That means you can receive over $31,000 a year with no taxes taken out. Pretty amazing. And all of that money will go to the veteran while he or she is living, and the surviving spouse once they're deceased. And then that veteran family will use those funds to pay for their community. So how do you get these big dollar amounts? Well, that's what everybody wants to know, what we're going to address today. You have to meet 4 areas of eligibility: military, medical, income, and assets. And so I'm going to deep dive into each of these as we move forward. A little bit about who aidandattendance.com is. Claire gave me a good introduction at the beginning. Essentially, we are a technology company. We help families and professionals understand the VA benefits criteria, who is eligible, and then how to apply. We are a lot like TurboTax for VA benefits. So this is a very long application. If you're going to try to do it by pen and paper, it's over 30 pages long. So rather than trying to struggle through that, you can use our software and get it done typically in about an hour if you have all of your documents. It's so smart, it will actually tell you if you've made any mistakes or omissions, and doing a perfect application is what's going to get it through the VA quickly. So I created this website with a VA accredited attorney. I have the background in senior care. I used to be a home care agency owner, and obviously a VA accredited attorney brings the legal background to our website. So I'm sorry, I'm seeing a little something pop up. It's distracting me. So there are 4 criteria. Let's start with the very first and most important one. So the first criteria of the benefit is military service of the veteran. In order for the veteran to be eligible, and therefore his or her surviving spouse to also be eligible, you need to have served 1 day of active duty during a period of war. No combat is required. That is one of the mistakes people often think. They think that in order to be eligible, you have to have been in Korea. You have to be in Vietnam. Not correct. You need to have served active duty during a wartime period, and therefore you are eligible in the military criteria. You also need to have 90 active duty days. So in order to be eligible, you need to have served at least 90 active duty days. They do not all have to be in a row. So if you're in the reserves, the National Guard, or the Merchant Marines, you might actually be eligible for this benefit. Many times the reservists and the National Guard, maybe they get called up for 30 days and then another 30 days and another 30 days. Well, if you put them all together, that makes 90 days. And all you need is 1 day of active duty during a wartime period, and the other 89 days could be during peacetime. Lastly, you need a discharge of anything other than dishonorable. So that would be honorable, medical, or general. Everything that I just covered is on the veteran's discharge papers. Now, if you don't know where your discharge papers are, we can help you order them. They essentially come from the National Archives, and we work with a third-party company to help expedite them out of the National Archives, typically in about 3 to 4 weeks. You need those discharge papers to go with your VA application in order to successfully get awarded this benefit. Lastly, a surviving spouse has to apply on their most recent husband's service. So that means if they were married to a wartime veteran and the wartime veteran passed and then they got remarried to a non-wartime veteran, unfortunately, they are no longer eligible for this benefit. If they were married to a veteran and then they got divorced, they're also no longer eligible for this benefit. So you do need to be married to that veteran at the time of death in order to be considered a surviving spouse. So hopefully I covered this one well. And if you have any questions about it, I will, of course, stay tuned for that later. Let's take a look at the second criteria of the benefit. Second criteria is medical. The VA wants to know, does the veteran or the spouse need care because of a physical or cognitive impairment? So a physical impairment means they need assistance with 2 activities of daily living. And the 6 that the VA recognizes are bathing, dressing, toileting, feeding, transferring, ambulating. Now, the easiest way to qualify for this benefit is by allowing the community to help you with a shower assist. A shower assist is bathing and dressing. That's help getting in and out of the shower and redress safely without slipping and falling. It is not a sponge bath. It is not dressing you like a baby doll. It's just a helping hand to make sure you're safe. Now, you might have a cognitive impairment, or maybe your loved one does. That is enough to qualify you for this benefit. You don't have to have the ADLs. As long as you have the cognitive impairment, the VA will recognize you as medically eligible. Now, you might also have something like macular degeneration or maybe Parkinson's disease. Those diagnoses on your 3-page medical form also make a strong case to the VA of why you are eligible for this benefit. Now, there is a 3-page medical form. It does have to be completed by any doctor or nurse practitioner. Another misconception is it has to be a VA doctor. Not correct. Anybody that takes care of your medical needs can assist with that. So it's 3 pages, then we have created a 4th page that you would also have that medical professional complete, which gives a better picture to the VA of why you are medically eligible for this benefit. Third criteria of this benefit is monthly income versus monthly care cost. So the VA looks at all incomes coming into the household and all care expenses going out of the household. Now, the reason I use the word household many times is if this is a married couple, the VA is going to count both incomes, even if only one part of the couple needs care. And sometimes that can be a problem. So they're going to look at 2 Social Securities, 2 pensions, wages if anybody's still working, rental income from any properties you're renting out, interest and dividends from any investments. And then the VA is going to let you reduce your income by your medical expenses. So of course, that's why we're on the webinar today. The VA will let you reduce your income with your senior living, with your personal care home, your home care, your nursing home care if you're paying out of pocket, adult daycare, health insurance, and long-term care insurance premiums. Now notice, these are only medical expenses. They're not going to let you reduce your income with your rent or your taxes or your food or your electricity. Only care expenses are what you can use to reduce your income. And here is why you want to reduce your income. So if you spend all or more of your income on your care, which is likely going to happen, the VA will say you have a net income of 0. 0 is a great number for this benefit. So even if this person was at $2,100 of care cost, they would still be at 0. 0 means the VA will consider you for one of those 4 full benefit amounts, the $14.32 all the way up to the $26.42. So I always recommend you spend slightly over your income to ensure you get the full benefit. Another important note is that the VA is going to count the entire invoice from your community, not just the rent, not just the care, everything. Whatever you're paying every month is what you can use to reduce your income. Again, this is why most people get the full benefit. Sometimes, however, people get a partial benefit, and this usually happens when we have a married couple where only one part of the couple needs care. So they've got 2 incomes coming in. This is probably 2 Social Securities and 2 pensions, and they're still spending the same amount of money, that $4,500 on care for that one person. Well, this family has a net income of $500, a positive net income. And so what the VA does is they just subtract it from their total benefit. So if this was me, I would think about what else I could benefit from at the community. Maybe more care, more days of shower assist, maybe medication management, maybe move into a 1-bedroom instead of a studio. If you spend $500 more, you're going to get $500 more from the VA. So there's no lose in this equation. If you spend more money, you'll get more care. Obviously, it's wonderful for the community, and the VA has an unlimited pot of money. So you're not taking these dollars from another veteran. So I would consider that if you do our survey online or speak with one of our representatives and realize you're not going to get the full benefit, you might want to go back to the community and start talking about what other great services they can provide to you. Last criteria of the benefit is countable net worth. The VA does look at your assets. And again, this is for households. So even if it's a second marriage and the money is kept separately, or there's a prenuptial agreement, it doesn't matter. The VA is going to count all household assets. And next year's asset limit is higher. It also goes up by 8.7%. So if you've ever seen the countable net worth limit for this year, which was in the 138s, it is now going to be over $150,000. So this is not a broke person's benefit. You can have a lot of money and still be eligible for this benefit. Now they will count all bank accounts, CDs, annuities, IRAs, 401ks, mutual funds, any real estate other than your primary residence, stocks and bonds. Now, what assets are not included? So they don't count your home. They will count it if you sell it, and we'll talk about that in 2 slides. But if you have a home and maybe one part of the couple still living in it, maybe you're renting it, maybe your kids are living in it, that's fine. You cannot pay for your senior living community with a window or a door. So if it's still a home, your primary residence is exempt, as is 2 acres around it. So that's a great thing. Most homes in our area are probably not on more than 2 acres. Anything more than 2 acres is going to be considered real estate in the top section, and you're going to want to tell the VA how much those extra acres are worth. Final expense policies. Those are prepaid funerals or burial benefits. If you have one, very smart. If you don't have one, we can help you with one, but it will not count against you. The VA is not going to ask about that. They also don't ask about vehicles and personal property. So if you are going to sell your vehicle or personal property, and that's going to make your assets, your bank account go over the 150, well, that could be an issue, but that doesn't likely happen. So typically I usually just say vehicles and personal property don't count. Now, if you are fortunate and you are over the asset limit, the $150,537, that's great. You too can become eligible for this benefit. However, there is a 3-year look back period. So if you plan to apply for this benefit and you're over the asset limit, you should still connect with us, and we can put you in touch with folks that know how to do appropriate VA planning. We don't want you to try to take it on your own, because if you do it wrong, the VA is allowed to slap you with a 60-month penalty, just like Medicaid, 5 years. So really, if you're over the asset limit, your worst case scenario is you're going to wait 3 years to get this benefit if you do the appropriate VA planning. If you do it wrong and you apply too soon, the VA will tell you you're not eligible for 60 months. So again, if you're fortunate, please just give us a call. We'll work through that with you and your family, and we'll see what we can do for you. Sometimes we can bring that 36 months down. Now, if you're going to sell your home, that is likely going to push you over that $150,000. Most homes in this country, especially our area, are over the $150,000. So we have a solution for that. If you plan to sell your home because you're moving into the community, we want to connect with you and then refer you to a VA accredited attorney. You can move that home into an irrevocable trust prior to applying for the benefit. And then when the home sells, all the money goes into the trust. It doesn't go to mom or dad. That helps helps the senior remain eligible. But what we don't want you to do is apply for the benefit, then sell your house, and you get more than $150,000 in assets, you're no longer eligible for this benefit after you were already awarded it. And the VA might even ask for some money back based on the date of the sale. So again, selling a home, please check into aidandattendance.com. We are more than happy to make a referral to help you become eligible or stay eligible for the benefit. So I'm going to do a couple of examples. This one is called Diminishing Funds. This is the story of Mary. She's a widow of a Korean War veteran, so she meets criteria 1. She needs help with activities of daily living, so she meets criteria 2. And she is an assisted living resident for 2 years, so she probably meets criteria number 3. She's now spent down to $75,000, which means she had a lot more to begin with. And she has a monthly income of $1,800 from Social Security and pension. By my calculations, she will run out of money in 26 months if she does not get on the benefit. That is because she has a shortfall of $2,850 every month that she pulls from her savings. We don't want to have it continue at this rate. So if we get her on the benefit and she receives $1,432, her shortfall every month drops to $1,418. This is going to allow her an additional 26 months in the community. I think I changed this slide. I'm not sure if I'm reading it right. So she's going to be able to be there for 52 more months. That is the goal. We want to extend someone's time in the community by providing additional income so they dip into their savings slower. It doesn't mean they're necessarily going to not have to dip in their savings, but we want them to dip in less so we can extend the length of time at the community. Now, this is a story about high income and high assets. Joan and Jack are considering senior living because he has beginning stages of dementia. They're relatively young at 81 and 80, and they're concerned how long they can afford senior living. They have $100,000 in savings and a home they're going to sell for $180,000, so really a total of $280,000. Their monthly income with Social Security and pension is $3,600, and they're going to need $5,750 to move in to pay for the rent and care every month at the community. Remember, there's 2 of them. And he has a high level of care as a memory care resident. Joan also needs another $1,000 of spending money. Some of that's fund money, some of that's bills, some of that's birthday presents for their grandkids. So a total of $6,750 a month. Here's what the 2 equations look like. Without the benefit, they dip into their savings $3,150 a month. That means they're going to run out of money in about 7 years. If we get them on the benefit, the married veteran amount is $2,642. They have a shortfall of $508 now every month. So they're dipping into savings much slower. And this is going to help their savings last 45 years. Very likely they're not going to outlive the money. That's great. That means some can go to their kids or their grandkids, and they're never going to have to worry about increases in care levels or running out of funds. Now, we did this by implementing estate planning in accordance with VA regulations, so they too can become eligible for the benefit. They're going to get the full benefit of a married veteran, $31,794 annually, and they can apply almost immediately. What we did is we increased their income by 73% with that VA benefit, and we were able to help them move in and not worry about paying for care. They can move in with peace of mind and start enjoying the next stage of their lives. So now I'm going to do some frequently asked questions, and then if you have any other questions, you're welcome to chat them in the Q&A or the chat box. Either one's fine. So the average approval time for a pen and paper application is about 6 months. That's because people usually do make a mistake or an omission, and the VA is going to ask you a question, at least one question, and then you're going to have to reply back. The back and forth takes an extra 6 to 8 weeks, and if they ask you 2 questions, it's probably going to be longer than that. If you do it on our software, we're seeing a turnaround time of 3 to 4 months, and that's because the software checks your application for you before you download and print it. Benefits are paid retroactive to the first of the month after the application is received by the VA. So that means if you apply by the last business day of any month, and the last business day this month is November 30th, so you've got plenty of time, then the VA will pay you money back starting December 1, whether it takes 3 months or 6 months or gosh forbid longer, they will pay you back to December 1 if you're paying for care in December. So there's a lot of urgency with this. You need to get that intent to file or the full application to the VA by the last business day of the month. You can find the intent to file, which is a very easy one-page form on our website. When you sign up to use the software, it's the first thing we're going to tell you to do. It'll take 5 minutes to fill it out, print it out, sign it, and fax it to the VA. Then you will have secured your December 1 date. You can take your time in deciding when you want to move into the community. As long as you move in sometime in December, they owe you money for December. The VA doesn't recognize a power of attorney signature. So the claimant needs to sign their own application with an X and 2 witnesses, if that's all you can get. Do not sign as a POA. That will kick that application back. So you really want to try to get whatever you can, and then 2 witnesses if all it is an X from the veteran or the spouse. The VA does not pay both disability compensation and the aid and attendance pension. So if we have any disabled veterans on the line, we need to evaluate, or you need to evaluate with us, if what you're getting is greater than what the aid and attendance benefit has. So if you're at 90% or 100% rating, you are likely getting a bigger benefit right now, and there's really no point in applying. If you're at 80% or less, at least at 80, you're going to get a little bit more, and below that, you're going to get a lot more. So the VA would stop your disability and would award you aid and attendance. You do not get 2 payments, but you, of course, are still a disabled veteran with all the health care that you get along with that. If an applicant's care is paid for by Medicaid, they can receive $90 a month. So if you start private pay and you then transition to Medicaid, you want to let the VA know you're no longer paying out of your own pocket, because this benefit is about what you're paying out of your own income, and they will reduce you to $90 a month, which is still $1,100 a year tax-free. I mentioned this before, but if a spouse is divorced from a veteran or remarries a non-wartime veteran, they will no longer be eligible for this benefit. Here is a quick snapshot of what the free survey looks like on aidandattendance.com. Hopefully you will visit there after this webinar, not right now, after this webinar, and take our free 5-minute survey to see if you're eligible. If you are, it's going to encourage you to do our application right online. We have an online application, as I mentioned a couple times. We have a one-time fee. There are 2 prices. It's $199 for your do-it-yourself software. And for $300 more, you're going to get support from my team members through a customer-only phone number. We can help you with the data entry. We can even review your application before you download and print it out to make sure it's in tip-top shape. Either of these will get you what you need, which is the VA benefit. So definitely hop on, take a look at the website. And if you prefer to give us a call and have a conversation with us tomorrow at 9 a.m., you are welcome to do that as well. Here is our phone number, as well as an email address. If you want to shoot an email to us, we will give you a call tomorrow, help@aidandattendance.com. Again, you can also just go to aidandattendance.com when this webinar is over, and you can do your own free survey to see whether you meet the criteria. If you happen to not meet the criteria, especially because of income and assets, you can ask for that to be referred to you as well, a referral for assistance with that. And that is the end of my presentation. I don't see any Q&A at the moment. I'm going to let you take over the screen again.
And thank you very much, Emily. And also this time I would like to invite Claire to come back and join us. Actually, Emily, we do have a number of questions that have come in.
I just can't see them. Okay, great.
Through the Q&A, so I'll be excited to kind of share those with you. So again, I want to thank everybody, and you can continue to submit your questions at any time during this Q&A session. Actually, Emily, the first question is for you. And
okay.
Can people in households with higher incomes receive this benefit?
Yes. Now, here's the caveat, and that's how Redeemer comes into play. So if you have higher income, you need to be spending that income on your care. So as long as you are using all or most of your income on your care, such as personal care, then your income reduces to 0 or close to 0, and the VA will give you that one of those 4 full benefit amounts or a large partial benefit. So you have to be spending money on care in order to receive the benefit and reduce your income.
Great, thank you very much. The next question actually is also for Emily. To qualify, does the veteran have to have served in a combat zone?
So no, you can be anywhere in the entire world during a wartime period. I had that question today from a family. They did not serve in Vietnam during the Vietnam era. Well, there's lots of other things that go on in our world, even during a war. And so many times that family or that veteran was serving abroad or even in the US, active duty, but they weren't part of that war effort or on the front lines. Maybe they were part of the war effort back home, but they weren't on the front lines. As long as you're active duty during the wartime period, you are still eligible.
Fantastic, thank you very much. A couple of questions have come in. Claire, this one's for you. Are your residents all of are your residents of all religious denominations? And you're muted, Claire.
Sorry about that. Yes. That is a question that we often get, and it is a great question. A lot of people think that we're strictly a Catholic, or our residents, I should say, are just of Catholic beliefs. Our residents are of all denominations. We have religious services for, we have everything from Catholic Mass, of course, to Shabbat services, to Christian worship. And, you know, I always say our residents are very inclusive of one another. Like it's just nice to see. We have Jewish residents that attend Catholic Mass and you know, Catholic residents that attend Shabbat. I think they just figure it's there, it's available, and you know, they just kind of enjoy, you know, everything.
Wonderful, Claire, thank you. Emily, back to you. Do you need to receive medical care through the VA in order to receive this benefit?
To the VA since they discharged many decades ago, but people think they have to start using the VA medical system in order to apply for this benefit and have a VA doctor fill out their the medical form. Not correct. Anybody can apply for it as long as you meet the criteria. You do not have to be going through the VA's medical system.
Fantastic. The next question also for Emily. In order to meet the healthcare criteria, is it required that a person have a cognitive impairment and need help with at least 2 activities of daily living?
So you either need 2 activities of daily living or a cognitive impairment. Sometimes people have both, but you don't need both. It's one or the other. The VA is not looking for you to meet both benchmarks in order to receive the benefit.
Very good. And actually, we have 2 more questions left. Now, before we get to those last 2 questions, I want to launch out a poll here for everybody. We're still going to address those questions. I'm going to launch out a poll here for everyone. You see on your screen. So please indicate if you would like to have a tour of Lafayette or of St. Joseph Manor. And a residential sales coordinator will be glad to reach out to you to arrange a convenient date and time. So while we're answering these couple last questions, please feel free to complete that poll. The next question is back to Claire. Claire, do you have a waiting list for your facilities?
We currently don't have a waiting list. There are certain styles of rooms and apartments that may be harder to come by, but we do have availability. So it's really just a matter of what we have available at, you know, any given time. So, you know, we would definitely encourage you to come and tour and, you know, see what you think of the accommodations, and, you know, you can definitely, you know, find something. We have something for everyone, I think, between the 2 communities, both apartment living and accommodations at St. Joseph's Manor that are our rooms.
Very good. And for Emily, does a spouse need to have been married to a veteran during the time of service in order to be considered a surviving spouse?
No, you can be married to the veteran at any point, as long as you are married to them at the time of death. Most veterans didn't get married before they went off to service. They got married when they returned. So in that situation, that's actually pretty unlikely for someone to have been married and then gone off to service. You only need to be married for 365 days in order to be considered a surviving spouse. So even if that's a late in life marriage, let's say at 85, you could get married. And if your husband, God forbid, passes at 87 or even 86 in a day, you then have the 1 year of marriage and are considered a surviving spouse.
Great. And I'm going to sneak in one more question here. We had another question submitted here just under the wire. And that question is, can the funds be used towards in-home assistance and not just in a facility?
Yes, they can be used for in-home assistance for home care. Many times, however, with home care, your income is still significantly higher than your home care. So you do have to pay attention. And if you're doing the survey, it'll actually tell you how much more home care you're going to need in order to get the benefit or to get the full benefit. Because if you're using home care only a few hours a week, that likely won't offset much of your income. So to get these big benefit amounts, you need to be spending all of your income on care, which when you're living at home, you have lots of other expenses. Typically, people don't feel comfortable doing that, so they don't get the full benefit.
And I keep saying it's the last question, but they keep coming in. So look, let's address one more here. Do both spouses need to live in the facility? Actually, can one still be at home?
Yes, both do not need to live in the facility. So you're applying based on the care needs and care costs of whoever is living in the community. What happens again sometimes is that if there are two incomes and only one person receiving care, they again might end up with a partial benefit because they're not spending all of their income on care. You just have to look at the equation, and that's what we can help you do. But absolutely, a married veteran who needs care can get that big 2642, even if his wife is still remaining at home.
Fantastic. And I'm just taking my time because just in case another one does sneak in there.
Yep.
But I do think we've actually reached our last questions, and I want to make sure that that we get a few more things in here before we conclude. Again, I would like to thank Emily and Claire for their presentation today, and also for all of you for participating. On the screen is the contact information. We strongly encourage you to reach out to Claire or to Emily. Their phone and their email addresses are here. They'll be glad to schedule some time for you. So please reach out to them as well. And we'll leave this up on the screen for a little while. I'm also going to relaunch that polling question that we had, just to make sure that for anybody else who didn't get a chance to tell us that they would like to continue and schedule a tour at either Lafayette or St. Joseph Center, you can continue to do that. So with that, I'd like to, again, thank you all for joining us. I'd also remind you that a recording of this will be sent to you via email after the program has concluded. Again, Emily, Claire, thank you very much. And to all of you who joined us for today, thank you very much for your time, and have a wonderful and safe evening.
Thank you. Happy Veterans Day.